Dhyan. Without any delay, I would like to call upon Dr. Mulidhar Sharma sir, STMC Udupi, to take over the session. Welcome to you, sir.
Okay, now next is about Keetakalpa. अर्थात Keetakalpam व्याख्यास्यामः यथोवाक्यभिवन्दनन्तैः. The word Keeta means the insects, smaller insects which are visible. Now, according to Sushruta, the Keetas are produced from the decayed material or excreta of the snakes, which is biologically not proved like. Sarpanam Shakrit Vinmutra Shavaputi Andasambhavaha Vaivagni Ambuk Prakrtayah Keetas Vividha Smutaha Sarvadosha Pratibhi Yuktaste Parinamadaha Keetatvepi Subhorasyuhu Sarveva Chaturvidaha. The Keetas or insects, according to Sushruta, are produced or generated from the decayed materials of the snakes, either excreta or their semen, or maybe their dead bodies, and they are categories into 4 categories: the Vata Prakopaka, Pitta Prakopaka, Kapha Prakopaka, as such, and Sarvadosha Prakriti, Tridoshaja. These are the 4 varieties of the Keetas. Or classification of those insects is only based upon the consequences over the body, may not be from their nature as such. Anyway, the other way, they also may be classified according to their nature and flying habits. Keetatvepic Subhorasyu, though they are insects, they can have some serious complications as such. Identification of this insects and their naming of the insects, that entomology of Ayurveda, entomology in the olden days is very well developed in the ancient India, and the identification would be Krishnabhihi, Bindu Lekhabhihi, Pakshaihi, Padamkaihi, Nakhihi, Shukaihi, Kantakalangulehi, Samskrishtihi, Pashmaromabhihi, Swanehi, Pramanehi, Samsthanehi, Lingeshchapi Shariragaihi, Vishabhijeshchikitanam Rupajnanam Vibhavyate. Identification of these insects and their classification is based upon the morphology of either their wings and maybe the color, dots or spots of color over the body, or by their the stings as such, or any hairy structure over the area, or the sounds they produce, or maybe the complications produced over the body after bite. By these features, identification of these insects are done. From the current biology point of view, again, insects are the type of the kingdom animal where arthropods, mainly the arthropods are the major category, and among the insects you have arachnids like the spiders and scorpions, and then among the insects mainly Hymenoptera, Hemiptera and 28 others. There are around 30 varieties of the orders of insects are identified, and there are about 5.5 million species of insects are identified according to the Entomological Society of America, and the total number of insects in the universe is guesstimated. It's not really accurate, guesstimated to be 12 quintillion insects on Earth at any given time. 1 quintillion means 18 zeros after 1. Now, among them, from the clinical point of view, Hexapoda insects are insecta and the Arachnida insecta. These are the 2 important conditions from the clinical point of view, from the point of view of bites and snakes. Now, hexapods are mainly, they are based upon their structure, like their body is divided. You can identify the 3 segments of the body like head, thorax and abdomen, and usually they have 3 pairs of the legs, and that's why hexapods, 6 legs as such. And usually 1 pair of the antenna and a pair of compound eyes. Compound eyes means where there would be multiple lenses in the eyes, and hence they can have a vision from all around. The field of vision of these insects are quite big, huge as such. Some of them there could be exception, and then usually they have 2 pairs of the wings, absent in many as lice, fleas, etc., but the majority of them have the wings. So the biological identification marks of hexapods are like that. Whereas arachnids are, they have a thick waxy layer over the body, or a thick hardened layer to conserve water, so that they can live in the area where the water content is lesser. They have internal respiratory surfaces, they can breathe in, and some structure resembling that of the respiratory system. Their fertilization of eggs and by sperm is within the body, and they have special sensory organs. Now, from Ayurvedic point of view, the insects are classified as the four categories, and they are Kumbhinasah, Tundikeri, Shringi, Shatakudirakaha, Uchitingo, Agninama, Chachichitingo, Mayurika, Avartaka, Tatha Urabraha, Sarika, Mukha Baidalo, Sharaba Kurdo, Abhirajihi, Purushaha, Chitrashirshakaha, Parushaha Chitrashirshakaha, Shatabahushcheschapi, Raktarajishcha Kirtidaha, Astadesheti Vayavyaha, Kitaha, Pavanakopanah, Tail Bhavanti Hedasthanam Roganah, Vatanimittajaha. 18 varieties of the Vayavya are those which produce Vata Prakopa are identified, and their names are mentioned. To identify exactly like which are those names now would be quite difficult. You need a lot of entomological research, which I don't know. So some area of again research may be needed to identify which are these insects as such. But in general, they produce symptoms of Vata Prakopa like pain and maybe the spasm of the muscles. Then Kauninyakaha, Kanapakaha, Varati, Patravrishchikaha, Vinasika, Brahmanika, Bindulo, Brahmanastada, Bashaki, Pichita, Kumbhi, Vachakito, Arimedakaha, Padmakito, Dundabhiko, Makara, Shadavadakaha, Panchalakaha, Pakamatsiha, Krishnatundo, Athagardabi, Klitaha, Krimisararija, Yaschapi, Utleshakastra, Yetehi, Agni Prakataha, Chaturvimshatirevajan, Tir Bhavanti Hadasthanam Rogaha, Pittanimittajaha, the 24 which can produce Pitta Lakshanas, aggravation of the Pitta. Among them, Kanabhaka and Brahmara, these are identified. Brahmara is the beehive, honeybee as such. Kanabhaka is a bigger this honeybee, like which is a wild type of the honeybee. Vishwambaraha, Panchashuklaha, Panchakrishna, Adhakokilaha, Saireka, Prachalako, Valabha, Kitibastra, Suchi Mukha, Krishna Godha, Yesta Kashaya Vasikaha, Kito, Gardhavakastiva, Tatha, Trotaka Evacha, Trayodeshite, Saummyasyuh, Kitaha, Shleshma Prokopanaha, Tair Bhavanti Hadasthanam Rogaha, Kapanimittajaha. The insects which produce the Kapaja Lakshanas or Kapaja Byathis are these. Then Tunginaso, Vichitrakaha, Talako, Vahakastata, Koshtagari, Krimikaro, Yestamandala Puchakaha, Tunganabha, Sarshapiko, Valgurihi, Shambukastada, Agnikitashta Vidyaha, Dwadasha Prananashanaha, Tail Bhavanti Hadasthanam, Vega Jnanani Sarpavat, Tashtavedanas Tivraha, Rogaha, Vaisanipadkaha, Ksharagni Dagdavardam Sho, Raktapita Sita Arunaha. Now these varieties, the 12 varieties of the insects, they produce envenomation, venom are contained there, and they produce the symptoms like that of the snake bite. Systemic consequences would occur. Primarily the issue is those which are the Tridosha, which produce Tridosha Prakopa, they have a venom in, and they produce after their stings rather, they will produce systemic complications, whereas the other three, they may produce the bites and there could be more local consequences. And the symptoms which could be produced are Jwara, Angamarda, Romancha, Vedanabhisamanitaha, Chardi, Atisara Trishnaschya, Daho, Murcha, Vijrambika, Vepatuhu, Shwasak Hikkascha, Daha, Shitam Chidarunam, Pidakopajaya, Shofo, Granthiyo, Mandalanija, Dadravaha, Karnikashchiva, Visarpaha, Kitibhanija, Tair Bhavanti Hadasthanam, Mithaswam, Chapi Padravaha, Ye Anya Tesham Visheshastu, Turnam Tesham Samadhishetu, Dushi Vishaprakopa, Chatrahiva Vishareparata, Lingam Tikshna Visheshetaha. Now, again, their categorization could be done into three categories: Tikshna, Manda, and Mrudu. The severity of the venom or consequences of the venom, and the consequences of venom. If there is a tikshna, if it's a very potent venom there, then the symptoms produced would be systemic, like Jara, Angamarda, Roma, etc., Romanchana, or gastrointestinal symptoms like Chardati Sara, or central nervous system symptoms like impaired consciousness or yawning or maybe tremors, or respiratory depression symptoms like breathlessness or hiccup or so on, or local signs like where there could be multiple eruptions, or maybe there could be ulcerations, or even there could be the gangrenous stages over the area. These are the complications of Tikshna Visha, the very potent venom. Then in the Mridu or Manda variety, प्रसेक अरेचक अरोचक छर्दी शिरो गौरवशीतकाः पिटका कोठकण्डूनां जन्मदोषविभागतः योगैः नानाविधैः येषां चूर्णानि गरमादिशेत् दूषीविषप्रकाराणां तथा च अनुलेपनात् by application of the bodies or a powder or medicines prepared out of these insects. Now some of the medicines are prepared with the body of the insects. Insects are maybe either powdered or crushed and they are applied as a treatment in certain diseases, particularly in the stimulation for the sexual urge. There the insects were used quite frequently. Now any of that application of the or physical contact of the bodies of these insects can produce the complications like dushivisha, that's cumulative toxicity could occur, and in mandavisha there could be the salivation, dyspepsia, vomiting and local swellings and pain would be the other symptoms in case of the mandavisha. From the current clinical point of view, all insect complications produced due to insect contact, they are categorized into two categories: bites and stings. Bites are those injuries or maybe the consequences of insect using its mouth, where the insect doesn't have a stinging structure, a special stinging instrument organ is not there in such insects, and there it will be only the local symptoms which are quite important. And often the insects bite when they are agitated or when they want to defend itself, like the mosquito bites, bed bugs and so on, which rarely produce a systemic symptoms. They are mainly the local symptoms that are produced, and mainly it could be the local irritation or maybe allergic reactions. Rarely in a severe case it could be anaphylaxis. But the most important consequence of the bite would be it can transmit the diseases. That's the important thing. Whereas stinging is done by certain insects which have a specialized structure. A stinging structure in an insect would be having a general organ, this apparatus, stinging apparatus may have a muscle protractor and retractor group of muscles which can make a pointed needle-like structure to penetrate out, and it's connected to a venom sac, the venom sac connected, and because of these actions of the protractor and retractor muscles, that stinging part could be penetrated into the tissue, then the venom could be injected and the same sting could be either retracted. Many times that retraction fails and the sting may remain at the site of the injury, which can produce another complication. So there, in case of the stings, there could be two sets of the complications. One, there could be the complications produced due to the venom, which would be specific, toxic. There could be many toxic complications, as in case of scorpion bite, there could be cardiac arrest and so on. Or there could be the complications because of the local injury, local bite, and there again in the local bite, if the sting remains over the area, if the sting is not retracted, then it can produce a foreign body granuloma. The complications of the irritation due to the foreign body also can occur. Generally, this is a general issue. Difference between the insect bite and a sting. In a bite, you will be mainly seeing local hyperemic changes. There may not be a visible disruption of the surface, whereas in a sting, you will see that penetration and that a clear-cut drop of blood could be seen. Many times, the stings could be visible. The complications of the bites are mainly local irritation, allergic reaction, rarely anaphylaxis. But more important is the transmission of diseases. If the insect bites, the major serious issue would be the transmission of the diseases. We know vector-based diseases, where insects act as vectors, malaria, typhoid, etc. Lots of filariasis, etc. Some of those diseases which are transmitted through the insects, which are well known, and the eradication of the insects and control of the insect is one of the major health issues now. Whereas with the stings, along with the local signs, systemic signs of envenomation would be the most important. And hence, in that condition, identification of the insect which has produced that sting, and if there are any specific complications produced with that, would be more important. The identification of the stinging insect is attempted or is done by studying the sting mark. There is a very detailed textbook available or a book available bite mark evidence, where you have the color atlas of the different wounds, by which you can shape of the wounds, which can be seen through a magnifying lens, and then the insect could be identified. And there are some new computer programs also, which can make use of the same intelligence, artificial intelligence, to identify the insect by looking at the, or by examining the bite marks. It's very advanced but such information now is available. Now the further the ketas, or the insects again, are categorized into ekajati as such. Ekajati natasturdhum ketan bhakshami bhedadah सामान्यतो दृष्टलिंगे ही साध्यासाध्यक्रमेण च त्रिकण्टकः कारिणी चापि हस्तिकक्षो अपराजितः चत्वार एव कणभाः व्याख्याताः तीव्रवेदनाः तैः दष्टस्य श्रवयतुः अङ्गमर्दो गुरुतागात्राणां दंशः कृष्णश्च भवति. Now Sushruta describes about certain specific varieties of the insects which were common and which were producing the complications at that time. One of them is Kanabha. Kanabha is a wild bee, honeybee, which we call as Kilikunda, a bigger size of honeybee, which is present in the wild area. And when it produces bites, it can produce Shvayatuhu, local swelling, Angamardaha, spasm, or maybe pain in the extremities, heaviness, or the local injury can become blackish, or maybe necrose as such. The wound can become necrose. And there again, among the Kanabha, the wild honeybee, Sushruta has categorized them into Trikantakaha, Karini, and Hastikaksha, Aparajita. The four varieties of them, of course, to identify that would be quite difficult. And another is a Godheraka. Godheraka is again another sort of the wild insect, quite difficult to make out. And they are Pratisuryakaha, Pingabhasaha, Bahuvarnaha, Nirupamaha, Godherakati, Pancha Godheraka. 5 Godheraka are there. And due to their bite, there again these are stinging insects, which will have shofaha, dahrujau bhavati, local swelling and pain would occur. Granthi pradurbaha, jvarascha, there could be even localized nodular swelling, and fever also can occur. Another is Galagolika. Galagolika, Shweta, Krishna, Raktaraji, Raktamandala, Sarvashweta, Sarshapika, Ityayam Shat. There are 6 varieties of them. Tadhi daste Sarshapika varjam dahashopa kledah bhavanti Sarshapikaya hridayapida atisarascha tas madhye Sarshapika pranahari. They can produce hridayapida atisara, cardiac depression, and diarrhea can occur, and Sarshapika is considered to be fatal. Then Shatabadi is something like a centipedes variety, and they are Parusha, Krishna, Chitra, Kapila, Pitika, Rakta, Shweta, Agni Prabha Testo. 8 varieties of the centipedes are mentioned in Sushruta. Tabhis daste Shopaha, Vedana, Dahashta Hridaye, Shweta Agni Prabhabhyam, Etadeva, Daho, Murchacha, Atimatram, Shweta Pidakot Pastisha. There again, local swelling, pain, burning sensation, and there could be a pale swelling over the area or along areas. Then Mandukaha, frogs, varieties of the frogs. Krishnaha, Saraha, Kuhakaha, Haritaha, Raktaha, Yavavarnabhu, Brukuti, Kotika, Cheti, Astav. 8 varieties of the frogs are mentioned. Of course, in the present biological classification, frogs are not categorized as insects. They are not in this category. They are among the other and these water-borne animals but still Sushruta had considered them among the ketas. Teidascha siddhamshe kanduhu bhavati pitafenagamascha vaktrata bhrukuti kotikabhyam etudeva dahaha chhardihi murchacha adimatram. Due to their bite, there could be a wound, itching in the area, and yellowish foam from the mouth. There even convulsive disorders can occur, and vomiting and unconsciousness can occur. Vishwambhara is another variety. Vishwambhara bhi daste lamsha sarshapakara bhi piraka bhi saruja bhi chiyete shita jvarartascha purusho bhavati. There could be local multiple eruptions, small eruptions at the site of the injury, and the patient may have a condition where the temperature may not be raised, but the feverish feeling could occur. Shita jvara, that's where the antarvega jvara. Something like the toxemia would occur in such conditions. Ahyandikabhi daste todadaha kandu shvayatho bhavanti mohascha kandumukabhi daste pita angas chartyati saraha atisara jvaradivihi abhyanyate shukavrantabhi daste kandu kotha pravartante shukam chatra akshare. Ahinduka produces a burning sensation, and Kandumaka produces a yellowish discoloration of the vomitus, diarrhea, jara, etc. Systemic complications. And Shukavranta is where the shuka, that sting, may be seen over the area, and there could be Kandu Kotaha, local eruption swelling. Pipilika, the ants, they are again categorized as Stula Shirshaha, Saumahikaha, Brahmanikaha, Angurikaha, Kapilikaha, Chitravarnati Shatu. 6 varieties of the ants are identified. Of course, you can see plenty of varieties of the ants now. Tabir Draste, Damshe Shvetuhu, Agnisparshavartadaha Shofo Bhavataha. There would be swelling and burning sensation in the area. I think many of you might have experienced the ant bites. There may not be anyone who has not really experienced the ant bite any time. And these varieties of the ants also are seen now, but none of them are really toxic. They are just local irritation and temporary phenomena. Makshikaha, that's bees. Kantarika, Krishna, Pingala, Madhulika, Kashayi, Sthalika, Ityevam Chatu. 6 varieties of the Makshika are mentioned. And Tabit Dasya, Kandu, Shofa, Daharujo Bhavanti. Sthalika, Kashayibhyam, Eduleva, Shavapidakotati, Upadravasya, Duradev Bhavanti, Kashayi, Sthalika, Pranahare. Kashayi and Sthalika, they can be fatal. And among the Sthalika and Kashayi, they may produce a bluish or blackish swelling in the area and systemic symptoms. In others, it could be local swellings and pain, itching would be the major clinical symptoms. Mashakaha are something like the mosquitoes. They are Samudraha, Parimandalaha, Hastimashakaha, Krishnaha, Parvatiyaha, iti Pancha. 5 varieties of the mosquitoes were identified at that time. Taidrasya Kivra, Kanduhu, Damshashofascha, Parvatiyastu, Kitehi, Pranaharehi, Tulyalakshanaha. The Parvatiya would be can produce fatal complications. In other, it's only the local pain, swelling would be the symptoms. Nakha Kruste Atyartam Pitaka Dahapaka Bhavanti. If a mosquito bite is scratched, and due to the scratching, the swelling and pain would be more. So, if you do not scratch, that would subside by itself. Jalokasam Dastalakshanam Uttam Chikitsadamcha. Jalokas, the bleachers, their clinical symptoms are mentioned in Sutrasthana. Bhavanti Chatra, Godheraka, Salika, Yeche, Shvetagni Samaprabe, Bhukuti, Kotikashtiva, Nasidyanti Ekajarshu. In the Godheraka, Stalika, and Shvetagni, Shvetagnisima, Bhukuti, Kotika, these are fatal. Shava Mutra Purishestu, Savishehi, Avarshanata, Sihu Kanduhu, Daha Kotha, Arup Pidaka, Toda Vedanaha, Prakletavan, Tata Sravo, Bhrisham, Sampati, Tajam, Digda Vidda Kriyastatra, Yathavada Achareta. The complications of the insect bites need not occur only due to the bites as such. Many times contact with their body or decayed material, their excreta also can produce symptoms of hypersensitivity like itching, burning sensation, etc. So, in all these, majority of these symptoms, they are suggestive of the local irritation and hypersensitivity reactions. Then Namasannam, Nautsannam, Atisamrabhavedanam, Damshada Viparitarthi, Kitadastam Subhadakam. If the swelling or the injury site, at the site of the injury, if there would be a local pain without either elevation or depression, without a evident sign locally, and there could be severe pain, that could be considered as a critical issue of, that can produce more severe complications. A local signs, if at the site of the bite, if the symptoms of local irritation are produced immediately, that could have a relatively milder consequence. That's due to the local irritation and maybe that there may not be any systemic toxicity. But if the local signs are lesser, systemic signs are more, that's a sign of envenomation, and these symptoms would occur quite seriously. Now, quite frequently, one of the examples is in the scorpion injuries, scorpion stings. Scorpions, even these spiders, more than scorpion, it's spiders. The spiders is very issue. Spider bites at the time of injury may not produce any symptoms. It may take around 6 to 8 hours for the local signs to occur. But some of the spiders are very toxic. It can be very fatal. And many times that fatal complication can occur before the local signs are seen. And many times the real reason for that fatal complication might not be identified. Many spider bites are have become fatal before they are diagnosed as such. That's about that delay in the onset of the clinical symptoms and the severity. दष्टान् उग्रविषयकीटैः सर्पोत्समुपाचरेत त्रिविधानां च पूर्वेषां त्रैविध्येन क्रियाहिताः. In all cheetahs vishas, particularly sting by its stings as such, the treatment will be like sarpa visha, where you will have to assess the systemic consequences of the poisoning and then the treatment has to be followed. स्वेदम् आलेपनं सेकं च उष्णम् अत्र अवचारयेत् अन्यत्र मूर्छितात् दंशात् पाककोतप्रपीडतात् विषग्नं च विधिं सर्वं बहुशः शोधनानि च. In general, in all insect bites, local warmth is applied, unlike that of the snake bites. In the snake bites, it's the shita kriya, the cold is applied, whereas in insect bites, warmth is to be used, or Ushnavidya dravyas are used, and the Vishakna Vidhi, all the Vishakna Agadas also are suggested as a treatment. And some of the examples are Shirisha, Katuka, Kusta, Vacha, Rajani Saindhavaihi, Kshira Madhya Vasa Sarpi Shunthi Vipalidarusho, Utkarika Stiradova, Sukrata Svedane Hidaha, Nasvede Adamsham Dhumum Mokshami Vristike. In the local fermentation with the this Utkarika, puri like substance prepared with the Shirisha, Katuka, etc., can be applied over the area. And the Svedana is not indicated in Vrishchika Visha, that is scorpion poisoning, the Svedana should not be done. Agadani Ekajatishu Prokshami Pradak Kustam Vakram Vacha Patha Bilum Mulam Subarjika Grihadum Haridre Trikantaka Vishehitaha. In the Trikantaka Visha, Kustavakra, these drugs are used. In Galagolika Visha, Rajani Agara Dhumashta Vakram Kustam Palashiram Galagolika Dustana Magado Vishanashana, specific Agada for a specific variety of the insects as such. Then Mandukadasta, in the frogs bitten conditions, Kunkumam, Tagaram, Shigru, Padmakam, Rajani Dvayam, Agado, Jalapistoyam, Shatabad Vinashan, that's Shatabadi. The first is about Shatabadi. Centipedes and millipedes, their injury, Kunkumam, Tagara, Shigru, Padmaka, these are used. Then for the frogs, Meshashangi, Vachapata, Nijuli, Rohini Jalam, Sarumanduka, Dastana, Magadayam Shapaha. For the frog bitten conditions, Meshashangi, Vacha, these drugs are used. And Vishambhara produced injuries, Dhavashva, Gandha, Atibala, Bala, Atiguha, Guhaha, Vishambhara Vidastana, Magadayam Shapaha, the specific drugs which are used there. Shirisham, Tagaram, Kustam, Shaliparni, Sahanishe, Ahinduka, Vidastana, Agado, Vishanashana. For the Ahinduka bait, these are used. Then Kandumaka, Vidastanam, Kandumaka variety of the insects bitten, Ratro, Shita, Kriyahitaha. Divati Neva Siddhanti, Surya Rashmi Paraditaha. If they bite in daytime, they may not be cured, they can become fatal, but in Ratri, in the night, you have to give Shita Kriya. Unlike that of the general rule for the insect bite, you have to have cold approach to the treatment. Then Vakram Kustam Apamarga Shuka Vranta Vishe Agadaha, Bhungas Swarasapistava, Krishna Valmikam Ratikaha. The Shuka Vranta variety, there it could be the Agada prepared with the Kusta, Apamarga Vakra, and Bringaswara, etc. Then Pipilika Bidhastanam, Makshika Mashikisada, Gomutrena Yuto Lepaha, Krishna Valmikam Ritika, Nakha Grusta Sanjate, Shofe, Bringarasohitaha. In the ants and other bees bite, a Gomutra Yuto Lepa, Krishna Valmikam Ritika, black soil with the Gomutra. And if there is a septic complication due to the nail injuries in scratch bite marks, Bringarasa is suggested. Pratisurya Dastanam Sarpalastavatareta, Pratisurya variety, it has to be treated as in case of the Sarpavisha. Trividaha, Bristikaha, Proktaha, Mala, Madhyamahavishaha, then more detail about the Bristika, that's the scorpions. And they are categorized into three categories based on Mandavisha, Madhyamavisha, and Mahavisha. Goshakrat Kotayaha Mandaha, Madhyaha Kaste Istikodbhavaha, Sarpa Kotadbhava Tishnaha Yetanya Vishasambhavaha. The categorization of these poisons, they are considered based upon their origin. Now, this again is a biologically controversial issue. According to Sushruta, if these scorpions are present in or generated in the dungs of cow dung area, then they are Mandavisha. Their poisonous effects are lesser. If they are present in between wood and maybe bricks as such, then they are Madhyavisha. If they are generated in the presence of a dead body of some snakes, they will be having severe Visha. So based upon their origin or the habitat of the scorpions, the poison is decided. That's according to Sushruta. Mandaha Dwadasha, Madhyastu Treha, Panchadashottamaha, Dasha Vimshati Tete Sankhyayaha Pariketlaha. The 12 varieties of the Mandavisha, 3 varieties of Madhyavisha, 15 varieties of the Tishnavisha are considered by Sushruta. Now, Krishna Shavaha Karburaha Panduvarno Gomutrabha Karkasho Merikascha Pito Dhumro Romasha Shankhava Shavmalabo Rakta Shvetana Udarena Iti Mandaha Yuktascheva Vristikaha Puchadeshe Sihu Bhuyo Parobhishta Itarebhyaha Yebhidashte Vedana Vepatushta Gatastambha Krishna Raklagamascha Shakhadashte Vedana Chaburdhvam Yeti Dahasvedo Damshashopo Jvarascha. The Mandavisha varieties are named as Krishna Shava, etc. And their identification is done by multiple nodes or multiple these nodes in the tail area of them, these joints and nodes in the tail area of the scorpions of the Mandavisha, they are more. And at that site of bite, they will produce pain, Vedana, Vepathu. There could be tremors, Gatrastambha, there could be reduced movement, there could be blackish blood flowing over the area, and pain may gradually move up or move proximally, and there could be burning sensation as such. Local signs are more important. Then Rakta Pita Kapilena Udarena सर्वे धूम्राः परोभिश्च त्रिभिः स्युः एते मूत्रोच्चार पूत्यण्डजाताः मध्याः ज्ञेयः त्रिप्रकाररोगाणां यस्य एतेषाम् अन्वयाद्यं प्रसूतो दोषोत्पत्तिं तत्स्वरूपं च कुर्यात् जिह्वाशोको भोजनस्य अवरोधो मूर्छा च उग्रा मध्यवीर्याभिदष्टे. In the Madhyavirya variety, they are Raktapita, Kapila, etc. Their varieties are mentioned, and they can produce symptoms of Jihvashofa, swelling in the mouth, and there could be obstruction to the passage of the food, laryngeal edema. That's a sign of hypersensitive reaction. There could be edema in the neck, edema in the throat, and respiratory failure also can occur, and they are produced due to Madhyavisha. Shvetaha Shvitraha Chitraha Shamalgre Lohitabha Rakta Shveto Rakta Nilodharaucha Pito Arakto Nila Pito Aparastu Rakto Nilo Nila Shuklastataja Rakto Babruhu Poro Cheka Parva Yeshta Aparva Parvani Chande Yasya Nana Rupa Varnataschapi Ghoraha Jayashtayo Vrishikaha Pranachoraha Janma Etesham Sarkotat Pradishtam Dehebhyo Aghatitana Vishena Yebhir Daste Sarpavega Pravurtihi Spototpattihi Bhranti Leho Jorashta Kebhya Krishnam Shontam Pitam Tivam Tasmat Pranihi Tyajyate Shigramema. Now, the Ugra variety, Ugravisha variety are these where there would be shape like either whitish color or reddish color and so on, and they usually are generated or produced in the presence of a decayed body of a snake, and their bite will produce all the clinical symptoms of a Vishavega, that stage by stage aggravation, and there could be local swellings also. Ugra Madhya Vishedastam Chikitset Sarpadastamad Adamsham Sweditam Churnahi Prachitam Prisarayat Rajani Saindava Vyosha Shirisha Palapushpajehi. The general rule of treatment for Ugra Visha and Madhya Visha are the same rule as that of the treatment of snake poisons as such. Then Matalunga Amla Gomutra Vishtam Swarasa Lepe for local application, Matalunga Amla Gomutra etc. they are used, and Swede Sukhostam Gomaya Hidimishare. For the Svedana, Gomaya is used, cow dung is used. For internal administration, Pane, Kshaudritam Sarpi Hikshiram Abhusharkaram, the Damsham Mandavishanam to Chakrata Hilena Sejayata, internal administration of Kshaudra and Sarpi, and honey and ghee together with the milk, or maybe milk with the sugar. So that's nourishing food is given. And Mandavisha wound, the Chakrataila is used for local application. देन् विदारे गणसिद्धेन सुखोष्णेन अथवा पुनः कुर्यात् उत्कारिकास्वेदं विषग्निः उपनाहयेत् फॉर लोकल उपनाहन विदारी गणादि विष उत्कारिका the puri like substance made and applied over the area also can be done. गुडोदकं वा सुहिमं जातकसंयुक्तं पानम् अस्मैः प्रदातव्यं क्षीरं वा सगुडं हिमं शिखि कुक्कुटबर्हाणि सैन्धवं तैलसर्पिषि धूमो हन्ति प्रयुक्तस्तु शीघ्रं वृश्चिकजं विषं कुसुम्बपुष्पं रजनीनिशा वा कोद्रवं तृणं ये भी कृताक्तैः धूपस्तु वायुदेशे प्रयोजितः नाशे दाशुकीटोत्थं वृश्चिकस्य च यद्विषं. Now, at the Vrishchika Visha, that scorpion bite, the internal administration of Gudodaka or any Shita Vidhi Dravya are used for local fermentation as well as the fumigation. The feathers of birds could be used for fumigation, or for fumigation again, Kusumba Pushpa Rajani etc. also are used for the treatment. As far as the scorpion bites are concerned, there are around 20 varieties of the scorpions which are identified in India. But the most common varieties, I am just referring to the most common varieties, and among the most common varieties, Hottentotta tamulus, which is really poisonous, or Mesobaetus tamulus, which is also called as Indian red scorpion, the first image here, and heterometrous species, that's among them Palameus grammatus, which is more common, Indian black scorpion. In our area, it's having a geographical distribution. In coastal districts, most of them are the black scorpions which are present, and they do not produce any poisonous effect. They serious poisonous effect. The local irritation and local burning sensation is the major symptom. Whereas Mesobaetus tamulus is one of the deadliest poison scorpion. It's one of the deadliest scorpion, and it produces a life-threatening medical emergency. Incidents of these are more common in the northern part of the India, and maybe in the Andhra Pradesh, and maybe somewhere in Madhya Pradesh and so on. In the central Indian region, these are more common, and bites also produce significant fatal results. Incidents and the fatal complications are quite high. This clinical signs of the tamulus toxicity is symptoms include severe pain at the site of the sting, vomiting, sweating, breathlessness, and alternating high and low blood pressure and heart rate. There could be the blood pressure and heart rate may rapidly change as such, and it produces a pulmonary and cardiovascular edema. Pulmonary edema is one of the major issue which can produce fatal complication. Cardiac arrest also can occur. Till 1984, the fatal results were very high. 84, the trial with the prazosin started. Prazosin is one of the drugs which is used in the treatment of pulmonary edema, and with that the fatality rate has significantly reduced. So now the current fatal rate of the red snake scorpion bite is very low, because prazosin has become a standard medical prescription now. Earlier to that, the fatal rate was quite high. That's in brief about the scorpions in the present day situation. Then comes the Luthavisha, the spiders. Luthavisham ghortam durvijnayatamam chatat dushchikitsatamam chapi vishagbihi mandabuddibihi sabisham nirvisham cheta ityevam parishankite vishagnameva kartavyam avirodhyataushadam agadanam hi sanyogo vishajustasya idyate nirvishe manave yukto agadat sampadyate asukam tasmat sarvaprayatnena jatavya vishanishchayah Ajnata Vishasadbhavam Vishak Vyapadanaram. Now, according to Sushruta, these spiders are highly poisonous, and their identification is difficult. Now, this is a true fact that the spider bite is difficult to be identified, because it doesn't produce the local symptoms in the initial stages. It takes about 6 to 8 hours. Then the symptoms would occur. And by the time the symptoms are seen, that systemic toxicity could be presented even if the bites are poisonous. Non-poisonous, that if there is a suspicion between poisonous or non-poisonous spider bite, according to Sushruta, you have to consider all of them as poisonous and treat with the agada before the symptoms would occur. So even if you have used an agada in a non-poisonous condition, it's not going to harm, the patient may be comfortable. But if you delay to identify the clinical signs of poison and then they treat the patient, delay in the treatment can produce fatal complications, and hence you have to treat at the early stage. And the simile given is prauddhyamanastu yatha ankurena navyakta jati pravibhati vrikshah tadvad duralakshadamam hila tasam visham sharire pravikirna matram. Like it's easy to remove a tender sprout than wait till the tree has developed to remove. Similarly, in case of the spider poisoning, early treatment will produce better results. The clinical symptoms which could occur due to the spider bite are ईशत् सकण्डु प्रचलं सकोठम् अव्यक्तवर्णं प्रसमे अहनि स्यात् अन्ते शिशूनं परिनिम्नमध्यं प्रव्यक्तरूपं च दिने द्वितीये त्रहेण तद्दर्शयतीह रूपं विषं चतुर्थे अहनिकोपमेति अतो अधिके अन्य प्रकरोति जन्तोः विषयी प्रकोप प्रभवान् विकारान् षष्ठे दिने विप्रसृतं सर्वान् मर्मप्रदेशान् विषमावृणोति तत्र सप्तमे अत्यर्थ परीतगात्रं व्यापादयेत् मत्यम् अतिप्रवृत्तम्. The spider poisons can produce the symptoms gradually, slowly, according to Sushruta. On first day, there will be not much of a local symptom, only there could be local itching. Second day, there could be swelling in the area, and the clinical symptoms of may become more severe. And third day, the visha signs, systemic signs could be seen, and by fourth day, the visha becomes more severe. Sixth day, all the organs, sensitive organs could be involved, and seventh day there could be poisonous, fatal complications. Of course, the fact is true that the spider poison could produce a delayed symptoms, but not exactly as 1, 2, 3 days. Like usually, the local symptoms would occur within 6 to 8 hours. Systemic toxicity would occur around 12 to 24 hours, and याः तीक्ष्णचण्डोग्रविषाः लूताः ताः सप्तरात्रेण नरं निहन्युः अतो अधिकेनापि निहन्युः अन्याः यासां विषं मध्यमवीर्ययुक्तं यासां कनीयो विषवीर्ययुक्तं ताः पक्षमात्रेण विनाशयन्ति तस्मात् प्रयत्नं विषगत्र कुर्यात् आदंशपाताद् विषघाति योगैः. The time taken for the fatal complications can vary according to the potency of the poisonous effect. Those Tikshna Vishas, they may produce death in 7 days, some others may produce symptoms fatal complications by 15 days or so. So hence, Sushil says every spider bite has to be treated carefully. Now as far as the spiders are concerned, again, there are many species of hundreds and hundreds of species of spiders now. Among them, highly poisonous is the recluse spider, brown recluse spider or Laxacillus reclusa, which is common, and in India also these are seen. Some Egyptian spiders also are considered to be acutely fatal and severe. And the typical presentation of the wounds would be by 6 to 8 hours there could be a scratching sensation. By around 24 hours you will have a vesicle, and after 24 hours there could be a ulcerative lesion. That's exactly what Sushruta says as the time sequence in case of the spider bite. The other complications which can occur could be that rash, as I said about this, fever, chills, nausea, vomiting. But the most important will be disseminated intravascular coagulation, hemolysis and disseminated intravascular coagulation, which takes about 3 to 4 days to develop, and there could be renal failure, seizures, coma, and even death can occur if they are not handled. So major complication will be coagulation, disseminated coagulation, which can affect any organ of the body in case of the spider venoms as such. Now, Visham tu lala nakhamutradamsta rajah purishaihi atachendriyena saptaprakaram visrajanti lutaha tadugram madhyavara veeryayuktam sakandu kotham stiramatvam moolam lalakritam mandarujam vadanti shopascha kanduscha pulalika vacha dhumayanam teva nakhagradamshe damsham tu mutrena sakrishna madhyam sarakta paryantam avehi dirnam damstami ugram kathinam vivarnam janihi damsham stiramandalam cha rajah purishendriyam hi viddhi spotam vipakva amala pilupandam. Now, according to Sushruta, the complications of the spider contact with the body could occur due to their saliva, their nails or that biting structures, their urine, or that powdery material over the body. Sensitivity could occur, and hence they can produce 7 varieties of the poisonings according to Sushruta. Now, this again is not biologically confirmed now. And the symptoms could be local swellings, there will be harder swelling, and in case of the saliva induced condition. In Nakhagradamsha, if it is due to that sharp bite of the nails, there will be local pain and reddish discoloration over there. If there is a urine of the spiders in contact with the wound, it produces the necrosis in the middle of the wound, sakrishna madhyam, and there would be a necrosis at the area, and with the bite as such, their teeth as such bite would be damsabi ugram katinam vivarnam. There could be local hard swelling. Then rajas or purisha produces a vesicle eruptions. Now, of course, vesicles are common in such cases, and necrosis also is a common. Now, from the present day's point of view, we consider this as a sequential consequences and resulting in the disseminated intravascular coagulation. यदावदेतत् समुदाहृतं तु वक्ष्यामि लूता प्रभुं पुराणं सामान्यतो दष्टम् असाध्यं साध्यं चिकित्सितं चापि यथा विशेषं. That's about the treatment of Luta Visha. Then Sushruta says about certain of the epical story about how the insects are produced and how the poisonous, the particular Luta, these spiders are produced. विश्वामित्रो नृपवरः कदाचित् ऋषिसत्तमं वशिष्ठं कोपयामास गत्वा आश्रमपदं किल कुपितस्य मुनेः तस्य ललाटात् श्वेतबिन्दवः अपतन् दर्शनादेव रवेः तत्समतेजसः तृणे महर्षिणा लूने धेन्वर्तं संवृतेऽपि च ततः जाताः तु इमा घोराः नानारूपा महाविषाः अपकाराय वर्तन्ते नृपसाधनवाहने यस्मात् लूनं तृणं प्राप्ताः मुनेः प्रस्वेदबिन्दवः तस्मात् लूतेति भाष्यन्ते संख्यया ताश्च षोडश. The lutas or spiders are named as lutas because of the epical story of a fight between Vishwamitra and Vashishta, and we know about the story of that the cow of Vashishta being taken by the Kamadhenu, taken by Vishwamitra, and so on. That in the present Sushruta's description, when the Vashishta became angry, there were drops of sweat formed on the head of the Vasishtha, and the drops of the head fell on the grass over there, and that drops of the sweat became the spiders, and because they are produced by the sweat over the grass, they are called as luta. कृतसाध्याः तथा असाध्याः लुतास्तु द्विविधा स्मृताः तासाम् अष्टौ कृतसाध्याः वर्ज्याः तावत्य एव च त्रिमण्डलाः तथा श्वेताः कपिला पीलिका तथा आलमूत्रविषाः रक्ताः कसना चाष्टमी स्मृता ताभिर्दष्टे शिरो दुःखं कण्डोर्दंशे च वेदनाः भवन्ति च विशेषेण गदाः श्लैष्मिकवातिकाः सवर्णिकाः लाजवर्णाः जालिनी एनीपदी तथा कृष्णा अग्निवर्णा काकाण्डा मालागुणा अष्टमी तथा ताभिर्दष्टे दंशकोऽथ प्रवृत्तिक्षुदयस्य च ज्वरो दाहो अतिसारश्च गदाः स्युः त्रिदोषजाः पिडकाः विविधाकाराः मण्डलानि महान्ति च महान्तो मृदवो शोभा रक्ताः श्यावाः चलास्तथा सामान्यं सर्वलोकानाम् एतद् आदंशलक्षणम्. Sushruta has described around 18 varieties of the lutas spiders, and their clinical symptoms are mentioned. Of course, practically to identify these would be quite difficult, so we depend upon the general signs of the luta. The important is the entomology and identification of these insects and their consequences in Sushruta's period were very well advanced. In the absence of the instruments like microscopes also, they could identify so many species. That's the important issue. But unfortunately, we have lost that detail now. Now, विशेष लक्षणं तेषां वक्ष्यामि सचिकित्सितं त्रिमण्डलायः दंशे असृक् कृष्णं स्रवति दीर्यते बाध्यं कलुषाः दृष्टिः तथा दाहश्च नेत्रयोः तत्र अर्कमूलं रजनी नाकुली कृष्णिपर्णिका पानकर्मणि शत्स्यन्ते नस्या आलेपनाञ्जनेषु. In the Trimandala variety of the spider bite, the local symptoms of pain and bleeding would occur. Treatment is with the Arkamula rajani etc. Shwetayaha pidaka, in the Shweta variety, pidakaha damshe shweta kandumati bhavet, daha murcha dvaravati, visarpa kledarukkari, tatra chandana rasna ela harenu nalavanjulaha, kustam lamajakam vakram naladam cha agado hitaha. The agada prepared with these drugs are used for Shweta variety. Then Tamra Kapila varieties could produce Adamshe Pitaka Tamraha Kapilayaha Sirah Bhavet, Shiraso Gauram Daha Simram Bhamevaja, Tatra Padmak Kusta Yela, Karanja Kakubatrajaha, Stira Arkaparni, Apamarga, Duva, Brahmyo, Vishapaha. These are the management for that the variety of the Lutavicious, scorpion bite, spider bite. Then Adamshe Pitika is Pitika variety of the spider would produce Pitaka Pitika Stiraha, Bhavet Chardidvara Shulam Murti Rakta Akshani, Tatra Ishtaha Kutaja Ushira Tunga Padma Vanjalaha, Shivisha Kirihi Shiluka Vamba Kakupatrajaha in the the Gilica variety, these are the treatment. Then Raktamanda Nibhe Pilaka Sashapaiva, Jayante Talushosha, Dahascha Ala Bishardite, Tatra Priyangu, Hribera, Kusta Yela, Kusta Lamaja Vanjulaha, Agada Shatapushpacha, Sapipalya Vatankuraha, Pita, these are the Raktamanda and Ala Visha acids. Then Puti Mutra Vishadamsho Visarpi Krishna Shonitaha, Kasa Shwasa Vami Murcha, Jwaradaha Samandita, Manashila, Maduka, Kusta Chandana Padmakehi, Madhumishri, Saramadihi, Agadas Tatakirtita, in the Krishna Visarpi variety, the complications and their management. Then Apandu Pidaka Damsho, the Pleda Samandita, Raktaya, Raktapariyanta Vijnaya, Rakta Sanyutaha. कार्यः तत्र अगदस्तोय चन्दन उशीर पद्मकैः तथैव अर्जुनशिरुभ्यां तद्भिः आम्रातकस्य च पिच्छिलं कसना दंश रुधिरं शीतलं स्रवेत् कासश्वासौ तत्रोक्तं रक्तलोकाचिकित्सितं. Now in all these varieties, Srishra has clearly identified the abnormalities related to the hemodynamic system. Hemolysis was identified, their variations are discussed. Now whether these variations do exist according to the species, and that kind of a study is not done now. Whereas Srishra has done that kind of a detailed study, so there is a huge scope for review of that spider poisoning effects and then analysis as such, which is not really done now. Anyway, from the current point of view, current knowledge point of view, we go for a casual reading as such. Purisha Gandhi Alpasrika Krishnaya Damshayavaja Garam Murcha Vami Raha Kasa Shwasa Samanyutaha Tatra Ela Bakra Sarpakshi Gandhan Akuli Chandani Himha Sugandhi Sahidei Pratyakya Agadas Mridaha. In the Purisha Gandhi variety of the spider, these are the symptoms. Then Damshe Daho Agni Vakraya, Agni Vakra variety will produce the complications with Damshe Daho Agni Vakraya, Sravo Atyartam Jvarastada, Josha Kandu Roma Harsha Daha Vispota Sanyutaha, Krishna Aprashamanam Chatra, Pratyakya Prajetu, Sariva Ushira Eschahva Chandana Uttalapadmakam, Sarvasam Eva Injita, Vishesh Leshmataka Twajam, Bishop Sarva Prakarena Tataja, Akshiva Pipalam. A general prescription would be Shleshmatakatvacha and Akshiva and Pipali. These are the drugs which are used. Krishnasadya Vishahi Asto Prokta Dvecha Yadruchaya Avarya Vishavidyanam Lakshanani Nibodhame. The Krishnasadya Visha and Avarya Visha, incurable signs of incurability and difficult to be treated are signs which are important, which are practical. Dhyamaha, Savarnika Damshaha, Sapeno, Matsikandaka, Shwasaha, Kaso, Jaras Krishna, Murchacha, Atra Sudarana, Adamshe, Lajavarnaya, Dhyamam, Puji, Traveda Sraka, Daha, Murcha, Atisarascha, Shiro, Dukham Jayate, Goro, Damshastu Jalinya, Rajimana Vadijate, Sambaha, Shwasaha, Tamo Buddhi, Talusho, Shashjayate, Yeni Padya, Tata Damsho, Bhavet, Krishnatila Kriti, Krishna Murcha, Jara Chandik, Kasa, Shwasa Samanitaha, Damshak Kakandika Daste Pandurakto Ativedanaha, Trun Murcha Shwasa Rudrogahika Kasa Sihu Uchidaha, Rakto Mala Guna Damsho, Duma Gandho Ativedanaha, Bahudacha Bisharieta Daha Murcha Juranitaha. The summary is whatever the type of these, whatever we cannot identify is the type of these specific species of the spiders. But a general sign is when there is a systemic complication, signs of hemolysis that can produce a fatal complication, they have to be treated. For identification of the spiders now, particularly in those areas in the USA, the spiders, they are, for the help of the general public, a spider chart is usually released, common man, so that the spider varieties could be identified, which are very severe spider poisonous spiders, less severe or no risk spiders, their shapes are presented. And the general guideline for the management is for the spider bite, first aid is keep patient calm, apply ice to decrease the pain and swelling, then anti-inflammatory drugs for pain relief, and contact your doctor. This is what is mentioned. And some of these spiders, specific toxic spiders, their antivenoms also are available now. Then asadhyasu abhihitam pratyakya ashuyajayat doshakshaya visheshena dahacheda vibarjitam. Even if it is a asadhya variety, You have to treat that condition without that local incision and local cautery. साध्याभिः आभिः लूताभिः दशमात्रस्य देहिनः वृत्तिपत्रेण मतिमान् सम्यक् आदंशम् उद्धरेत्. If the signs are suggestive of a better prognosis, local excision of the wound is suggested by Vrittipatra. You will have to excise the area of the wound and that affected tissue has to be excised. Again, from the correct point of view, this is not suggested. अमर्मणि विधारज्ञः वर्धितस्य ज्वरादिभिः दंशस्य उत्कर्तनं कुर्यात्. ಅಲ್ಲಿ ಅಶ್ವಯಥುಕस्य च मधुसैन्दवसंयुक्तैः अगदैः लेपयत्ततः प्रियङ्गु रजनीकुष्ठ समङ्गा मधुकैस्ततः सारिवां मधुकां द्राक्षां पयस्यां क्षीरमोरटं विदारी गोक्षुरक्षौद्रमधुकं पायेत वा क्षीरिणां त्वक्कषायेन सुशीतेन च शेतेत उपद्रवान् यथा दोषं विषग्नैः एव साधयेत्. The local excision of the wound bite area, tissue which is affected, is one of the suggested treatment by Sushruta, and then local application of the specific yogas to make the wound heal. Nasya anjana abhyanjana panadhumam tatha avapidam kavalagraham cha samshodhanam cha ubhayataprakaadam kuryat silam mokshanam eva chatra. Other alternative remedies which could be used are nasya anjana abhyanjana, धूमपान and avapidanasya kavalagraha or shodhana, woman abhirechana also are to be done as a treatment. Keetadashta vranaन् sarvān ahidashta vranaन् api adah pakat tān sarvān chikitsayat dushtavat bishaka. All the wounds which are produced due to either snake bite or insect bite, they have to be treated as in case of the dushta vrana. Then vinivrittya tradashophe karnika patanam hitam निम्बपत्रं त्रिवृद्धन्ति कुसुमं मधु गुग्गुलु सैन्दवं किन्नं वर्चः पारावतस्य च विषवृद्धिकरं च अन्नं हित्वा सम्भोजनं हितं. Once the acute complications are reduced, you may give a food which will reduce the visha as such, and their food is mainly nimbapatra, trivruddhanti. These are used for the food as such, supplementing food. विषेभ्यः खलु सर्वेभ्यः कर्णिकां मरुजां स्थिरां प्रच्छयित्वा मधून्मिश्रैः शोधनीः उपाचरेत्. If there is a firm part of the insect left over in the area wound and there is a granulation there, then prachana has to be done and that area has to be cleared. सप्तषष्ठस्य कीटानां शीतस्य शतस्य एतद्विभागशः दशलक्षणमाख्यातं चिकित्सां चाप्यनन्तरं सविंशमध्यायशतम् एतदुक्तं विभागशः. The treatment of the 76 variety of Keeta, 76,000 varieties of the Keeta are mentioned here and their treatment is described. Iha Uddishtan, Anirdishtan, Arthan, Ukshami, Atha Uttare. If there are anything left over, they are discussed in the Uttaratantra later on. सनातनत्वाद वेदानाम अक्षरत्वाद तथैव च तथा दृष्टफलत्वाद च हितत्वाद देहिनां वाक् समूहार्थ विस्तरात् पूजितत्वाद च देहिभिः चिकित्सात् पुण्यतं न किञ्चिदपि शुश्रुमः. ऋषेः इन्द्रप्रभावस्य अमृतयोनेः विषग्गुरोः धारयित्वा विमलं मतं परमसम्मतम् उक्ताहार समाचारः इह प्रीत्य च मोदते. So that Sushruta Samhita, that original Sushruta Samhita ends with the Kalpasthana. Uttaratantra is supposed to be a later edition, and hence Sushruta gives a concluding statement like all that text which is mentioned here has to be considered as a very auspicious text, and every word of that has to be considered as auspicious, and you have to follow it with respect. And if you follow, remember it properly and use it in the clinical proper conditions, you can treat the humanity well. With this, we conclude the Kalpasthana. This is Sushruta Samhitayam Kalpasthane Keetakalpo नाम अष्टमोऽध्यायः. इति भगवता श्री धन्वन्तरेण उपदिष्टायां तच्छिष्येण महर्षिणा सुश्रुतेन विरचितायां सुश्रुतसंहितायां पंचमं कल्पस्थानं समाप्तम्. Next we will take up the Uttara Tantra, which is again practically important. If there are any questions, we will try to answer. Otherwise, we will wind up. Okay. No questions, so we will wind up today.